Hi everyone, it's me, Lindsay, again with EquipMeOT, here today to talk about maintenance of a cervical collar or a neck brace. Either one I'm going to be going over how to clean, how to change the pads, basically how to keep this brace functioning for the entirety of your need for it. So I have two different types of braces here, both very common out in the community. I've got a Miami J and I have a Aspen Vista collar. Both of these are ones that you might see issued out of the ER if you're dealing with a traumatic neck injury, or potentially for a surgical recovery, or even in situations with a degenerative disease that might cause cervical neck weakness or intolerance for head support. So these braces are commonly used in those situations, and they have very similar styles, very similar types of maintenance strategies, so I'm going to go over them kind of together. So let's go ahead and get started with one of the most important things about maintenance of a cervical collar, and that is having access to a second set of pads. It is completely essential that anyone who's going to be using a cervical collar for any length of time have a second set of pads available. This is not only a maintenance issue, but a safety issue. If one of your pads becomes damaged or unusable, having a second set of pads there will prevent you from having your neck in an awkward or potentially damaging situation. So it's very important that before you leave your surgical office or before you leave the hospital, you have a second set of pads available for you. It is possible to buy a second set of pads online. I'll have links down below for both of these braces if it's something that you need to order right away. So the Aspen Vista is really commonly used in post-surgical situations or more long-term wear situations. It's a slightly more comfortable brace. It's less cumbersome, a little more lightweight, and kind of an easier brace overall to wear. The Miami J collar is really common in trauma. We see this coming out of the ER a lot. It's a little bit bulkier, has a lot more plastic on it, but overall both braces are going to be maintained very similarly. You can see they have different types of foam inserts in them. These are a kind of a soft foam. These are going to install the same way as these ones with Velcro. These ones are actually a satin finish, which some people really like, so that's kind of a nice feature with the Miami J. One little caveat with the Aspen Vista, this one does have a neck adjustment piece that is done using this pull-out knob. It's very important to know that if you're a caregiver or you yourself are using one of these braces, you shouldn't be making adjustments to the brace fit by yourself. That should be done with you and your healthcare professional team to make sure that that neck brace is supporting everything properly. So it's very important that you don't mess with the fit of your brace during the wearing process. So if you're uncomfortable or feel like it's not fitting properly, please contact your medical professional right away. Okay, let's talk about how we clean these pads. So when we open up the brace, there's a front and back on both of these. So you can see here, I've got a front and back piece. There's 3 foam inserts. We've got one for the chin, one at the neck, and one at the back. Same thing with the Miami J. One at the chin, one at the neck, one at the back. What's really, really important and a great idea is to take pictures. The first time you remove the brace to do any kind of pad management or adjustment, take pictures of how the brace is put together. Take pictures at all angles so you can see the landmarks and know exactly how these pads are going to go back in once it's been disassembled. I can't tell you how many times I've been in a patient's home and found that their pads had been put in wrong a second time around and found people to have really uncomfortable situations, even pressure sores from the plastic rubbing on them because the pad was in the wrong spot. So it's so important that you know where these pads go back in once you've removed them. Okay, so once you're comfortable with how the pads are in, you can go about taking them out to have them cleaned. When you take out the pads, they simply remove via Velcro, just like that. These are going to have a Velcro side, so a loop side, and then this white smooth side, similarly as the Miami J. These have to be cleaned with a very gentle detergent. You can use something like an all free and clear detergent or a Delft, something that would not have any extra dyes or chemicals. And actually my favorite way to clean these is a little hot water and baby shampoo. Baby shampoo is free of most of the irritating dyes and chemicals and will also remove a lot of the skin oil that can build up on these over time. And they have a fresh scent to them. It's much more pleasant after they've been cleaned. So simply soak them into a little bit of hot water and then a gentle soap. Give them a little rub to clean them, and then rinse them very thoroughly. You don't want soap residue left behind, so only use a small amount of soap and give them a really good thorough rinse when you're done. These can then be hung to dry Gentle wringing out is okay. You don't want to get too aggressive because you can rip these and cause damage to the foam. So just a gentle wringing to get some of the extra water out, and then hang them to dry. I find that the vast majority of the time, these will dry in 24 hours or less if they're placed in a place that's nice and dry and warm. So hang them out to dry. You can have them that way with 2 sets of pads. You can always be rotating in a clean set. You'd be amazed how dirty these get, and if you don't change them frequently, you do run the risk of bacteria growth. They can get really unpleasant smelling and even cause some fungal growth if you're not careful. So I highly recommend switching these pads out every 24 hours or so. Some people wait to do it for their shower days, and that can be okay if you're not particularly sweaty or they haven't gotten super dirty. And they can be, you can actually shower with the pads on. I'm going to do a video about showering with these neck braces, so stay tuned for that if you're interested. So the next thing we're going to talk about is the actual process of removing the brace so you can safely change out those pads and make sure that you yourself are keeping your neck stable, or if you're providing assistance to somebody, that you're keeping their neck stable throughout this process of changing out the pads, so stick around. Okay, so we're back and we're going to go ahead and remove the brace in order to remove the pads to replace them now that they've been cleaned. So I do not have a second set of pads, so I'm just going to kind of demo this as if I did. So I've got my client or my loved one laying flat on their back. This is really important. They cannot have any pillows behind their head in order to make sure that that cervical spine stays completely still and level while we do this process. This is really the safest way. It can be done sitting up, but most surgeons really recommend and prefer that you do it laying flat. So we're going to remove the front plate first. So by gently, and I'm going to actually tell him to find a point on the ceiling and fix his eyes on it. His job is to stay completely still throughout this process, okay? So we're going to go ahead and remove the Velcro. And then I'm going to take off the front plate very gently, and we're going to remove the pads. At this point, it is possible to go ahead and give the plastic a little wipe down as well. Still, it should be done with a very gentle cleanser, some water and soap only. It's possible to use a alcohol wipe if there's a very stubborn soiled spot, but most of the time just a very gentle amount of warm water and soap will do the trick to clean the plastic as well. When we replace the pads, we want to make sure that the plastic is fully covered so that we don't have any spots where irritation can form or pressure points. So we go ahead and place the pads directly back on right where we found them when we started so that we have full coverage of the brace plate. Okay, so now we're going to go ahead and set the front portion back in place. Should go right on because he hasn't moved his head at all. I'm going to keep my hand over this part while I remove the back plate. Gently, very gently and slowly, because we don't want his head to turn when we pull this. We're going to gently pull out the back portion. Okay, so this part on the Miami J is just one solid piece like this. On the Aspen Vista collar, it's going to have to be removed. There's the straps of Velcro actually go around your thing, so it takes a little bit more time, but take your time, make sure it's on correctly when you replace the pad. Completely cover this back up. Now to put it back in place, I like to use these straps to help me. So we're going to kind of gently guide the strap underneath the natural arch of the spine, and that's going to kind of act as my fishing line here. I'm going to reach under, find that strap very gently, and then we're going to compress it down on the mattress just a little bit and pull it into position. If the pad gets a little bunched up, you'll need to adjust it slightly and make sure it's still secure. And then we're going to go about refastening the Velcro. Now, there's a very good chance that this is going to need to be adjusted once your loved one or the person who's laying here has sat back up. That's normal. At this point, though, the neck is secure for them to be able to move around safely. So there you have it. Some maintenance on a neck brace to make sure that those pads stay clean and well maintained for good skin integrity and comfort. So if you have any questions or comments, leave them down below. If you got some value out of this video, give me a thumbs up. And as always, if you need more information on how to stay safe and independent in your home and community, consider subscribing to EquipMeOT. Thank you.